get as much information as we can so we can be aware and make the best choices. So there are forums like this that help us get information to each other and then share with our communities. That's critically important for our long-term survival. We will need to, as I said, self-govern, and then that in turn will make all of us leaders. All of us will be the leaders for our homes, for our communities, and hopefully some leaders will see that and get some ideas that they don't potentially consider for themselves, but they can get from forums like this and see that there are some other options, some other choices, and other considerations that they have to make when it comes to areas that they may not spend as much time in, like in this instance, the impact of women and children in Africa. So I'm glad to be here, glad to do my part. As Andrew said, I am in the hospital right now, so I'm going to put myself on mute because you might hear some very interesting sounds out of this particular room at 1:30 in the morning in the United States, in California. And so to prevent that from probably scaring you, I'm going to put myself on mute until I have to speak or I'm asked something. But again, I'm glad to be here and look forward to not only this today, but future forums where we can, like I said, be the leaders and be the world that we want to see, and to share that with our friends and colleagues. So God bless you all, stay safe, and I am here at your disposal. God bless.
Well, in that case, again, let me welcome you all to this meeting. What I would love to do is briefly just review the material that has already been printed. As you all know, this is, in fact, a worldwide challenge for all of us. So I want to honor and thank Blessing and this team for stepping up to address this issue and bringing us all together to have a conversation about it. So actually, it's Noor who invited me here, and if he can unmute himself, perhaps he could be so kind as to give us a brief introduction. Or if I would be so bold, could I please ask you to introduce your organization? And we are recording this, I'm certain, but it is important also. I noticed we're sharing to Facebook. Could someone put a chat link here so we can invite others to participate with this as we go along from Facebook? Or if anyone here has the link, because I do see we're streaming Facebook Live, and I'd love to be able to invite other people that are awake to join us, if at all possible.
Okay. Savera Africa is a non-governmental organization in Nigeria, which is focused on promoting education for women and children across Africa. We also focus on halting gender-based violence and promoting gender equality at the same time. And we have come together as a team with the Goodwill International Endeavors Initiative to put this all together to see how we can prefer solutions to the COVID-19 pandemic and as it affects women and girls in Africa. We know women are the most hit globally, and we have more women who are on the front line in the fight of this COVID-19 pandemic. And most importantly, in Africa, we have about 60% of women who are health workers, and it is definitely women will have to go back. Their primary caregivers, they would have to go back to their homes, take care of their children, families, and when they could also contract this virus. Most of them also are losing jobs across Africa. We have more women who are now losing jobs, who are basically earning less as well. So we are coming together to see how we can prefer solutions. We can collaborate with government and put policies in place so we can really have something working for women and girls. That is why we have organized this conference, and to hear from people all around the world, to hear from experts as well. We have Dr. Kuldip. We also have Mr. Andrew Williams, who is also going to shed more light on the COVID-19 pandemic. For some of us in Nigeria, we feel people are asking the question, is the COVID-19 real? For some of us, we're doubting, and most importantly, maybe because of our governments, maybe because our governments don't really come out plain and tell us how it is. So we want
Blessing,
to hear from
Blessing, can I just say something to you there about that business?
Okay.
Is the pandemic real? The virus is real.
Okay.
It hasn't really started to bite in Africa proper yet. And I have posted on all of the Learn with Grandma African groups a thing that gives very clearly what is happening in the UK so that they can learn from that. I've also posted a very nice little graphic produced actually in Liberia of the things that you can physically do to save yourself. But until we get through to Africans that they must stop getting so close together. I keep seeing photographs even now of congregations of Black people coming together in Africa in huge numbers. If one of those has the virus, then you're talking about a bushfire. It really is important that we stress to people, although very few people have died in Africa yet, that if it comes, it's going to be dreadful.
Well, let me, if I also may, Blessing, Lady Alicia Hamilton is the CEO of the Revelation Network, trn.tv, and she's actually covering every day the worldwide statistics on that. So at the appropriate time, I would like to have her to be the one to speak on this. She has much more up-to-date information than I do on it.
Okay, are we going to have her?
That's up to you. She's available.
Okay, probably you can share the link if possible to her so she can join us.
She's here. She's actually among us here. Alicia, can you unmute yourself?
Okay, Alicia. Okay, Alicia. Okay.
Yeah, I did in the chat. I put the website link. It's TRN, the Revelation Network, trn.tv. And if you click the link, you'll see the daily updates there. So Alicia, if you can unmute yourself, Alicia Hamilton, if you can hear me.
Yes, yes, I can. It wasn't quite prepared to do this, but I have, as Andrew has shared, when this started, I was in the hospital, as I mentioned earlier, and I had nothing else to do but follow the news. So I initially started just taking notes, and then it turned into a job. So every day I have been getting up and tracking the data globally on the number of infections, the number of deaths, and also the news that follows the trend. And it's been quite fascinating, tragic at the same time, but it also helps us to make decisions because of the data that clearly shows that this is real. And I thank you, Sister Valerie, for your comment coming from the UK, which is, I think, just a little bit ahead of the States, I believe. And so what happened initially, it came out in China, and then went over to Spain and Italy, and then to the UK, then to the States. And so Africa is about 9 weeks behind the rest of the world when it comes to the spread. So that's very important because although it initially looked like, oh, it's not here, it just hadn't gotten there yet. And so if it is there, there is a high probability that people who have it will be able to spread it to other people because the virus is transmitted by droplets. And so when people cough or sneeze or even speaking, they've found out that when people talk, because when you talk, you can expel droplets from your mouth. Those droplets are falling on surfaces, not necessarily have to fall on a person, but because it stays alive on surfaces for hours, and I'm not even sure about how long, maybe even days, they're saying. I'm not sure about what that actual number is because I've heard various reports from the amount of time. But the thing is that someone could be long gone by the time you come along and touch a surface. And so many people are wearing gloves to protect their hands or using hand sanitizer, or if that's not available, washing the hands, because what is happening is the droplets, let's say somebody, just for a case, someone is traveling by public transportation and they walk outside and the person before them got on the bus, sneezed or whatever, and the droplets got on, let's say, the bus handle or a railing or a button you have to press for access. You know, this could be an elevator, a bus, anything public. So that person comes and goes, and then you come along and no one's around. So you think, okay, it's fine. Well, those droplets are still on the surface. And so if you turn around and then touch that surface, you can actually get the virus on your hands. And so what they're saying here is that if you then unknowingly have these droplets on your hands and then touch your mouth, which is an entry point, your nose or your eyes, you know, you rub your eyes, people do that more than they even realize, touching their face, then it can enter the body. And so innocently, you could be fine and then be somewhere with someone you don't even see because they're already gone, but the droplets are there. You can then contract the virus, carry it, and because it's asymptomatic, which is the term for not having any kind of symptom, that you can be walking around with it, actually spreading it to other people through droplets. And then this thing is spreading and you don't even know because people are walking around looking well and they're actually sick and able to spread the virus. And so then that person touches their face, they're talking to their family members, they're touching things along the way. It's just crazy. And so that's why we have to act as though it's here, even if we don't see it. One of the things that we're doing here in the States is to wear masks. So if we do have it, and the droplets are expelled from our mouth, that it stays in the mask and doesn't spread to surfaces or to other people. And then also some are wearing gloves. Some are wearing hazmat suits who have them. It's amazing. You may have seen the pictures of just covering their whole bodies. That's kind of overkill, but at the same time, coverage so you don't spread is very important. And then as we have heard, we can only go by what we're sharing and what we're hearing from the scientists is that people who have underlying health conditions are more likely to get sick and die from the virus, which is one of the reasons why I'm in the hospital, because I'm currently fighting cancer, and my doctor somehow arranged for me to stay in this little bubble that I'm in because I have a comorbidity, and they're trying to keep me around. So that's why I'm here, doing better, but I have nothing else to do, like I said, but just pay attention to this all day. And so from, I think I'm on past 60 days now, that every day I get up in a couple hours here and get the global numbers and post them on the site. I'm gonna try to, I don't know if I'll be successful here, but I'm gonna try to share those numbers with you. Let's see, it says I can share my screen. So let's see if that actually happens. Because what I've found is this trend, and this trend has been commensurate with the numbers, the decisions that our leaders are making along with the numbers globally. So let's see if I can do this successfully.
While you're sorting that out, Alicia, can I just make a comment? You said about sanitizer as being superior to soap. In fact, medically, soap is better than sanitizer. So using soap and getting to a good lather is better than sanitizer.
Absolutely. I hope I didn't say the word superior, because I certainly didn't mean that. We are using sanitizer when we have it, but soap, you're absolutely right, works way better because for some reason the virus attaches itself to the soap, and then you can rinse it off. So washing your hands several times a day, you're absolutely right. And if that came across, my apologies, because I certainly didn't mean to infer that it was better than soap.
And the other thing is that I have posted a video on African groups that have Learn with Grandma groups on how to make soap. Now, this is a brilliant idea for African women because this could indeed become a little business for them after the pandemic. So actually, when we finished, Andrew, can I send you an email which you can distribute to everybody? I think that would be the easiest way to pass on this information.
Yes, please do.
Okay. I've still got the clip.
Okay, thank you, Valerie. And I know I'll get that from Andrew when he sends it. I'm going to attempt to share my screen. We'll see what happens when I press the button. Oh, you disabled participant screen sharing. Okay, so if anybody can undo that, I'll share my screen, but for right now it's been disabled. So I'll just tell you what I see here. Well, I mean, I don't know who knows and does not know the global numbers. So at this point, you know, we have had, that's hard to do without seeing this. Okay, so 4,920,173 cases, and it's really hard to do this without my screen. I can't do both. Put me on the spot. Let me try this one more time. Actually, I'll go to the data set for today. Okay. Forgive me, guys. I wasn't really prepared to do this. I have the numbers, but I can't control it and see it. Okay. So
I think you can.
People, pardon?
You can make the second attempt to share your screen. I have made it shareable.
Oh, I can share it now? Okay, let me try it again. It'll be a lot easier if I can just look at the screen and do it at the same time. Let me try it.
You can try it again.
Okay.
I have made it shareable.
Okay, great. Okay, can you guys see this, my screen?
Yeah.
Yeah.
Yay, look at that. Technology is wonderful when it works. Okay, so these are yesterday's numbers. Like I said, I post today's numbers generally at between 4 and 6 a.m. I'll show you that data set too before we leave, but these were yesterday's numbers. And so I've been tracking the continents, and then of course my little area here, New York, California, and LA. But you can see as of yesterday, we were at 4,920,000 people. We may have surpassed 5 million. We'll look at that shortly. And in Africa, we've had 88,579 cases, 2,839 deaths. So you have a 3% death rate and a 38% recovery rate. And those numbers, unfortunately, have been growing. Like we say, Africa is 9 weeks behind the rest of the world. Globally, you have Europe has the most number of cases at 1,975,000, and then the USA following at 1,550,000. And then from there, you have China, and then Africa and Canada. So in looking at the trends, what is significant to me is that Africa is 9 weeks behind the rest of the world, but yet those numbers are right now in a global trend has already surpassed China. So it is a point of concern. We know that, and we've heard in the news that Brazil has also been climbing high in the rankings. And when you look at Brazil, you'll find out that of the South American report, oh, that's right, I'm sorry, I missed them. Of the South American report of the 461,000 people in Brazil, over half of them, in South America, of the 461,000 people, over half of them are in Brazil right now. So they are ranking third, and then Africa. But this is posted at trn.tv. And if you can pull that up on your computers at your convenience whenever you want to. I do post this every day and looking at the trend, and I'm going to keep doing it until the recoveries in this area are in a higher percentage. As the deaths go down and the recoveries go up, I'll try to stay on the job I created for myself to plan it. I knew that was going to go on this long, but significantly, these are all these are all people. These are all people. These deaths are all families. They're brothers, sisters, mothers, fathers, and it's so tragic. And we have to reduce these numbers. And again, I personally believe that's going to come from self-governance. I will try to, I don't know if this will let me do it, but I'm going to try to show you the trends for today. This is a site that has, we passed 5 million people. Then I don't know if you guys can see that. So today's trends, we have globally passed 5 million confirmed cases, 325,000 deaths, and approaching 2 million recoveries, which is really good. But we want the recoveries to be higher and the deaths to be lower. The confirmed cases, you have people here who are not necessarily passing the disease, maybe if they're like, there's this study now showing that people who've had the disease and recovered, so in this area here, that they're not spreading the disease, but that's not for sure. And I probably won't go down this lane because I'm not a doctor. I'm just looking at numbers and statistics and reports in the news. But hopefully that little bit of sharing has been helpful to you all in terms of what's happening around the world. And we can see that we are in an active case, or not necessarily active here, I just mean globally. This is the active situation. Just because the governments or whoever is in your authorities locally have decided things can open, or and they can go about shopping because of the economic pressure, it does not mean we're safe. And so it's critically important, again, that we are able to self-govern and do what we have to do individually as citizens to protect ourselves and protect the people around us. So with that, I'll pause, and if anybody has any questions about what I've kind of been tracking here as a citizen. Seriously, I'm just a citizen. This is the work I've been doing and will continue to do until, as I said, these recovery rates get to be 100%. Right now, China is the closest one at 94%, and then in Oceania at 92%. So hopefully that was helpful.
Yes, thank you so much.
A little comment that I would make, and it's not, how can I put this? It's not that I'm devaluing this virus, because it is dreadful and the figures you're giving are dreadful. But more than that died in World War II. More than that died from Spanish flu way back. Throughout history, man's history, we've had periods of being culled. And this is a period that we're going through now, when a proportion of the population will be lost. That is not the end of the battle. That is not the end of the war. The human race will survive this. The economic crisis that is looming will take longer to get over. But actually, the climate change crisis that is coming is the one we really should be worrying about, because there, countries like Bangladesh and the Netherlands could well disappear completely. All of our coastal cities will be lost. We're now concentrating on this because this is what's happening now, but we must actually have a new future, not get back to normal. You look at the skies now, there isn't a single plane in the sky above me now. One day I counted 14 vapor trails over my house at the same time. So that was before the lockdown, of course. We have to go into a new way of living where we are actually living sustainably.
Thank you so very
Well,
much. Thank you so very much, Valerie. I know the topic today is COVID-19.
yeah.
Dr. Sharrock, if I may share my screen, both Alicia Hamilton and I are members here in Los Angeles of the Los Angeles Trade Technical College Architectural and Environmental Design Department, Community Think Tank and Advisory Board. The chairperson of that, Professor Marcela Oliva, has created a 1-minute video that shows how people can use a common item to create masks. So they don't have to purchase them. They can take 5 to 10 minutes and actually make them from household items. So it's
I've
only a
done that
minute
too.
long. If I may share that, Dr. Sharrock, I would like to do so.
Yes, for formal good morning to all of you. In fact, I will be speaking, making a general kind of discussion. First of all, let me extend my greetings for organizing such a wonderful conference, and more importantly, which is related to the half of the world, which is the women and the girls, and that too in the continent, which is generally considered to be in the process of development. So my concern is, since I have almost 5 to 6 minutes time to speak on my topic, to take care of the women and the girls in the continent, I think we have to have a multi-dimensional approach to look into their issues. Now, there can be issues related to the general awareness, which Alicia has already focused on. We need to create a general awareness among us, the people, and more importantly, among us, the ladies. Now, that can be what to do and what not to do about in the new normal. That may be using the mask, washing the hands frequently, keeping the social or the physical distance, or maybe while washing the hand, we also need to use soaps and sanitizers. That is a kind of thing which we need to make people aware of, that which will come under the general category. And then we also have 2 or 3 more important areas which we need to focus on. And those are basically, since it is related to the women and the girls, I will pick up primarily the socio-psychological issues, the ladies who keep on undergoing a different kind of difficulties when they are not socially, I mean, they are locked in the lockdown position when they are not able to do the social interaction. Obviously, when the lockdown is for quite for a longer period, then we being the human beings, we tend to get a kind of depression. So when we talk about the depression, which is the psychological issue, then we are also getting the anger, the irritation, the mood swings, and what not, which are related to the psychological factors. So therefore, when we need to look after the women and the girls in our continent, we also need to focus on how do we need to do the counseling, how do we need to give them a kind of advice, and the related things. So because of the depressions, because of these mood swings, medically, which I have encountered or seen certain cases with my friends, there are certain hormonal changes in certain ladies, and they are suffering from different kind of issues. Example, their menstrual cycles are getting different. And being locked down, there's another issue which is also looming for all of us, is the increased amount of unwanted pregnancies. And in fact, when I talk about the pregnancies, of course, then it is also related to the issues about certain abortions taking place, certain miscarriages taking place, or sanitary issues, which we are not taking care of. So that this is one area where we need to take focus on when we need to address the issues of our women and the girls. And then coming down to the medical issues, we also need to look at 2 dimensions again. One is the medical fraternity per se. Are they equipped to handle these kind of issues in their hospitals, in their clinics? Whether they have sufficient PPEs, whether they have sufficient gloves, or masks, sanitizers, or related kind of machines, which is in certain cases we also need ventilators. In certain cases we also need medicines, the ambulances, and related things. Are the capacity of the hospitals to accommodate such an enormous number of patients over there in hospitals? So that is the things. And more importantly, in this kind of situation, we also need to look at a very strong support from the social volunteers. The medical fraternity as their own, they are not in a position to do the service at their own per se, but obviously they need a sufficient social support from the volunteers who can help bringing the patients to the hospital, take them around, and that they can keep on continuously giving them kind of input for getting rid of this pandemic. Now, this pandemic is it's not very easy to get rid of, but we have to start looking at how we can start living in the new normal. A quick brief I would like to give you. This pandemic is, of course, in 2011-12, we had the H1N1, H1N1, and then we had SARS, then we had these similar kind of things. Now, this is also one of the another virus, influenza virus. So obviously, when we are talking about the influenza viruses, these have the tendency for the mutations. So over the period of time, what we need to develop is we need to develop the immunity, and this immunity can be taken care of by doing some exercises, certain eating habits, lifestyles, kind of things. And if we look at it, the people who got severely affected are where the mortality rate has taken place. This has taken place only the people who have been basically suffering from the comorbidity. Now, comorbidity, when I talk about, they were only selected kind of comorbidity where the patients have died. Now, the comorbidity, the people who have been suffering from lungs disease, TB kind of thing, the people who had heart issues, heart problems, the people who had been suffering from severe diabetes, the people who had been suffering from serious kidney problems. So largely, the deaths those have taken place across the globe. This is a number which has basically suffered, and this is again largely has happened to the people who had been obese or were overweight. So I'm not trying to say the deaths have not taken place in the rest of the category. The larger number, when I say 90% of the number, is that has happened only towards to the people who have been comorbid and only into the selected areas. So that means we need to take care of the people who are suffering from these basic disease, and then we have to go forward. Looking at the objective of conference during this conference, we will try to find out the issues, and then of course we'll also try to find out solutions to it. So how we can go back to the government to take care of this thing, and number two, how our social organizations can also be very operative and very effective in the entire scheme of things. I think government at its own, if we keep on expecting everything from the government, that may not be very judicious. So what we need to look at it, we also need to make our social organizations very powerful, very participative, and therefore we can collectively handle this situation. Having said this thing, I wish all the best to this conference, and would like to listen to the other speakers. Thank you very much.
Well, thank you very much. And anyone that's not speaking, please put yourself on mute. just to let you know, we're going to proceed through the agenda. So please take notes to ask the speakers questions at the end. The next guest will be Dr. Tamara Omar. I've had the pleasure through Dr. Mohammed Kota, who is here, to introduce her to this group. She is the CEO of Pay Raw Money Transfer Platform here in Houston, Texas. So Dr. Tamara, if you could unmute yourself, and everyone else, please mute yourself, then please introduce yourself.
Yes, thank you, Andrew. I'm really glad being in front of all of you today to discuss a very important matter. It's about COVID-19 and its impact on women and girls. As Mr. Andrew said, my name is Tamara Omar. I live in the United States of America in Texas, Houston. I'm the CEO of the money platform. It's like it's named PARIM, and it's about payments. Also, I'm president of a lot of organizations and vice president of American International Education Federation and president of American Group. Again, I'm really happy to be today between all of you to discuss this important matter, and I hope it's going to be really useful, and we're going to have a real conclusion for this conference. So today I'm going to talk about the impact of the COVID-19 in a woman economically. So countries around the world are working to contain the spread and impact of the COVID-19, which is the coronavirus. Evidence from the past indicates that women can be affected in particular ways and in some areas face more negative impacts than men. Women stand to lose the most during the coronavirus pandemic, but steps can be taken to ensure that women's role in the company and in the economy are all industries can be made strong during the recovery phase. Economic challenges during the outbreak pose a serious threat to young women's work and business activity and expose them to increased risk of exploitation and abuse. Women facing severe economic shocks are more likely to take on high-risk work of their economic survival. Responses to the outbreak must protect and support young women's economic empowerment. The specific needs and contributions of women as workers, business owners, and entrepreneurs must be better understood and addressed when developing measures to reactivate the economy. All aspects from accessing financial rescue packages, credit and unemployment benefits to removing barriers for women to perform high-skilled and better-paid jobs should be considered for the economic recovery to be effective, inclusive, and sustainable. Today, more than ever, there is a need and an opportunity to rebuild a sustainable market system capable of generating value, positive impact, and profit at the same time. Also, companies shall recognize this need, as well as its competitive advantage to create specific business strategies aimed at reducing the gap between men and women. Stimulus packages must include social protection measures that reflect an understanding of women's social circumstances and recognition of the care economy. This means ensuring health insurance benefits for women, those most in need and paid for sick leave, and for those unable to come to work because they are taking care of children and elders at home. Also, leaders must find a way to include women in response and recovery decision-making, whether at a local, municipal, or national level. Bringing the voices of women into decision-making will lead to better outcomes. The women's empowerment should be through implementing principles and procedures and offering guidance and everything possible on how to promote gender equality and women's empowerment in the workplace, marketplace, and community. And thank you so much for giving me the opportunity to talk about how COVID-19 really impacts the women and girls all over the world, and to collaborate all together to find how to solve or how to find solutions to get better effect on women. Thank you all.
Thank you very much. And I would ask you in the chat of Dr. Amar to type in your contact information or your website information so we can follow up. The next speaker will be Mr. Stephen Tin, but I do not see him present. So the following speaker would be Sarah. Sarah, are you there? Can you unmute yourself, please? And everyone else, please mute yourself if you're not speaking. But Sarah, if you could unmute yourself and please introduce yourself to our team. Thank you so much for joining us.
Thank you, Andrew. Good morning, everybody. I'm Sarah. Sarah Jegedeto. I'm, of course, a lawyer and former co-chairperson of the National Elections Commission of Liberia. I am in Monrovia right now, or outside on the outskirts of Monrovia in an area called Marshall, Margibi County. And I want to greet you all this morning and talk about the situation of women and girls in Liberia as far as this pandemic. But I have been informed this morning by Alicia that Africa is 9 weeks behind. This is very concerning to me because what has happened in Liberia about in early April, when we learned of the pandemic initially being in Liberia, which was March, in the latter part of March, we learned that the pandemic was in Liberia. And in early April, the government decided to decided to lock down the country. So about the 8th of April, the president announced that the country would be locked down. So for the past, say maybe 5 weeks, we have been locked down. And looking at the 9 weeks behind, it really concerns me because what has happened is that the people of Liberia, after 2 weeks of lockdown, the initial 2 weeks of lockdown, people tried to abide. We had Ebola before, so we were used to washing our hands with soap. Initially, in fact, it was not soap and water, but it was Clorox and water. And now we've added soap. And we were used to that culture of washing our hands. And so that's something which everybody sort of tries to abide by. But the distancing, the social distancing, the other aspects of the pandemic are not sort of are things that we are trying to abide by. But as you know, our society is one that is very, very is packed with people who are unemployed. We have a high unemployment. We have a high illiteracy level. And so after the 2 weeks, our people decided that they were no longer going to be locked down. And so even though, of course, a curfew was put in place, which we have to abide by the curfew, that's from 6 in the morning to 3 in the afternoon. And people abide by the curfew, but they do not abide by the social distancing. They don't abide by other aspects of the pandemic because they are impoverished by and large. We have a very poor society. We have a society where we are clustered together. There are people who live in shanty houses. We call them zinc rounds or mat houses. And these people, when it is night, when night falls, they go and they, go to sleep in these houses. In the meantime, the people who also live in these houses, they get up and they have to go out to find food to sustain themselves. I, along with two other women, decided that what we would do in our neighborhood, because our neighborhood is, as I said, on the outskirts of Monrovia, we decided that we would walk around and sort of try to talk to these people in the shanty houses and tell them about the pandemic and tell them about the protocols, tell them they should wash their hands, they should use masks if possible, social distancing. But, it was sort of difficult. So I decided, well, okay, let me sort of help the situation, and went out to buy masks. I bought 150 masks. I bought soap and Clorox. But what you have a situation where people don't have buckets. You give out the mask, you give out the soap, you give out the Clorox, you tell them, okay, fine, if you don't have a bucket, most people have buckets, but they don't have buckets that they necessarily use for the washing of hands. And so you have to tell them, well, you can use a bucket, you can put a nail, puncture a hole with a nail in it, and the nail will stop the leakage of the water. And when you want to use it, you pull out the nail, wash your hands from the leaking water, and at least that will at least help to keep the virus at bay. But as I said, we had Ebola, and Ebola was a different disease. It showed where people, you could hear the sirens, you could see the truckloads of bodies being moved to the burial, to the cremation sites, and people, it impacted on people. But with this virus, which is sort of very silent and not evident, you see that our people are saying, in fact, as Alicia said, we're 9 weeks behind. So people are saying this virus isn't here. You understand? They are saying it isn't here. And now that with this knowledge that we're 9 weeks behind, maybe the virus has not impacted us fully. And when it does impact us fully, it will be disastrous, because we're looking at something like, okay, fine, this is the 20th of May. We're looking at, that means the whole of June, the whole of July, and then at the end of July, it will sort of impact us fully. And because of the impoverished situation of our citizenry, we will really have a disaster. But let me look at the situation with women and girls. Women and girls are already vulnerable. They are vulnerable in the normal setting. And in this pandemic, they are even, the aspect of vulnerability has been exacerbated. You find that most of the women in our marketeers, they go to the markets, they sell their wares. And what has happened now is that most of the women are no longer able to go to the markets, or they go to the markets. Those who are able to go to the markets, but for a shorter duration. Because if the curfew starts from 6 in the morning to 3, that means that you have to wait until 6 before you start going out. Then you close your market maybe at 12 or 1 to be able to get back to where you reside. Because a lot of people live, they do live far from the market, or sometimes, they have a lot of things to pack up to leave the markets. So that has put women in a position where they have lost income. They have also lost their freedom. They have lost their freedom of movement. They have lost their freedom, of what you call it, like sort of a certain privacy, because now you have everybody staying at home, everybody's locked down. You have a situation where there is increased violence because people get annoyed. Men are now staying at home. They are not able to go and hang out with their friends and do the things that they usually do to keep them occupied. Yes, to keep them occupied.
Yes.
Hello?
Yes, we're here.
Can you all hear me?
Yes.
Okay, yeah, they don't have, so you find that they get annoyed with their wives, get annoyed with their children. It's vice versa. Everybody, this pandemic has put everybody in a situation where they are, locked down. It is not normal because as human beings, we are people who affiliate and integrate and interact with each other. So this situation is very odd and strange because people just, they unannounced, they come to your house and suddenly from what is the norm, you have a situation which is so abnormal to our culture. As I said, we walk around the environment. I live in an area which is a sort of a newly developed, but a lot of the properties around or the land around are occupied by what they call caretakers. And these caretakers live in these zinc rounds or these shanty houses. They have no running water. They have no toilet facility. They use the bushes by and large. So we have been walking around and trying to educate them, but it's a woeful situation. The government is trying its best. If you want to lock down a group of people, you have to make provision for their welfare. And you see that there is the distribution of rice, but I was walking around and I happened to see this group of people in front of their house. And I went there, and I went there specifically because there was a child. The child looked as if it was 9 months old, but I found out the child was 2 years old. And it was time for feeding. And so the mother brought her a plate of food. The food was fufu and soup. Fufu is something that is made from the cassava plant. It is fermented and then it's cooked. And the soup is usually something that is cooked, is like a sauce, but it's a little watery. And this child was given a plate with 5 lumps of fufu. The mother had cut it up into lumps for her to swallow easily. And she was given a spoon. She took the spoon, she stirred it around. She was not interested, I guess. She figured that was the normal thing that she had been exposed to. And I walked away, came back an hour later. The child was still sitting in the same place with the 5 lumps of fufu. So she was not motivated. Then I said to them, well, somebody needs to feed this child. And I wanted to go and buy food and bring it for this child. But I said, for how long will I be buying food and bringing it for this child? Then you have so many situations. You have young ladies. I met a 23-year-old who had 4 children. 4 children in this type of situation. The first one 6 years old. And this is a situation that goes on and on and on. I mean, you see it. We have so many challenges. The COVID-19 has come, and it is really, you know, we have the gender ministry who are working on the task force that has been established to sort of ensure that women and girls are particularly educated and, of course, to extend their help. But it's a difficult situation here in Liberia. And I know it isn't only a Liberian situation, it's an African situation, because those people who are impacted, especially women and girls, because you see men, they will always brave it and go out there. And another thing is the fear factor. Initially, people were extremely afraid. But now, for instance, I have social media where I can get education. But those people, they do have phones, but you have to be able to afford to see what is on social media, you have to put data on your phone. And they cannot afford to put data on their phone to be able to see all that is happening. Alicia also mentioned that in Africa, the trend at this point in time, when China experienced the virus, was not as high as Africa is. So we're looking at it exponentially. If we hit in 9 weeks' time, what will happen? Because by that time, the people will, if it has not really manifested, people will really, they will say there's nothing here, and they will go back to business as usual. And it's going to be very, very difficult without having the resources to really cater to them. It'll be difficult to contain the spread of the. We do not have the facilities. We don't have the medical facilities. We just don't have anything to be able to combat a situation like that. Let me thank you all for listening to me. And thanks for inviting me on this forum. I conclude at this point. Thank you.
Sarah, thank you so very much. It's so critically important that we have viewpoints from the ground for the world to understand. I do want to also ask this. I see the next guest is Obatumbi. I don't see him here, but if he's here, Vincent Lynn, were you scheduled to be a speaker, Mr. Lynn? No, I guess that was 10, I apologize. So in the order of the schedule, I'm the next speaker. I'm going to take this opportunity first to say that the issues that we're addressing here with the impact of women and children on Africa is actually one of the 5 Sustainable Development Goals. This is an attempt of the world to come to grips with these challenges that are existing on the planet. Now, for those of you that may know, this Sustainable Development Goals is not something new. It actually is a continuation of what happened in the year 2000, when if you could mute yourself, please. In 2000, the United Nations set out the United Nations Millennium Development Goals for 2000 through 2015. However, that was conceived by a group of a handful of men in the bottom of the United Nations basement. And so 15 years later, of course, the world needed a reset. So in 2012, there were about 3 million surveys done worldwide to contribute to what now has become the Sustainable Development Goals. Africa at the time was itself defining what it's now called the Agenda 2063. So they had developed what's called a Common African Position, and that is in fact the largest regional impact on what is now the Sustainable Development Goals. So I just wanted to acknowledge the fact that what you're sharing with us, Sarah, is a problem that is worldwide. I'll take one further step and say that in 2011, there was what was called the International Year for People of African Descent. The United Nations decided later we would have an entire decade. We're actually in that decade right now, from 2015 to 2024. That's because the things that you're experiencing in Africa, as Alicia has said, are happening as well around the world in communities of African descent. Brazil is a prime example. There were, I'm on the National Advisory Board of an organization called Project 1619. We were the first ones to acknowledge and identify that 400 years ago, on April 25th of last year, the first Africans arrived in what is now the United States, then Virginia. But that's only a small portion of the number of Africans that traveled throughout the world. Primarily, they went to Central and South America and throughout the Caribbean. But I'm going to take this minute now, if I may share my screen, and just for 1 minute, share with you a very simple solution. Here in Los Angeles, we have 11 million people in Los Angeles County with 88 cities. And where I live, it's in the one of the poor areas. But almost from the first day, our mayor, Garcetti, enforced strict social distancing and face covering rules. I'm proud to say that up to, I would say 80% of the people that I've seen are actually doing that. And that's one of the easiest and most efficient ways to prevent the spread of the virus, because it is, as Alicia mentioned, it's distributed from your mouth around. So if you have your mouth covered, you're not just protecting yourself, you're protecting other people around you. But let me take 1 minute, if I may share my screen, and provide a demonstration that was created by Professor Marcela Oliva that would allow us to take some measures at home that could make it very easy for us to self-regulate our activities, to actually take advantage of our opportunities right now. Can you see my screen? Okay, I'm going to play this now.
I'm not sure this will work 100%. Hi guys, I'm not sure this will work 100%, but we can be very creative, and as creative humans, we are going to succeed with this. So here's how you can make your own mask.
Okay, well, watch it if you cannot hear it.
You guys have
watch.
You can't see it. It's showing something green. It's showing a green screen. Choose a different screen, maybe.
Oh, I see. Okay. Just a minute. Okay, just a minute.
And you just put it over your head.
Let me try another shot. Oh, yeah, I see it here.
Openings large enough.
Yeah.
Hi guys, I'm not.
Is that better?
Sure this will work.
Yes.
But we can be very creative, and as creative humans, we are going to succeed with this. So here's a way how
the volume's very low, though. Can you get the volume closer or turn the volume up?
Unused socks.
It's as high as I can get it, but just watch the demonstration.
This is how you do it.
Okay, thank you.
These socks have naturally the ergonomics and the triangulation, and you just put it over your head, and you want to make the openings large enough so it can be behind your ear. You don't even need to sew anything.
She's just taking a sock, as you can see, just a regular sock. Here in America, we have a lot of cotton socks. I don't know what the situation is in Africa, but it's just a sock. And all she's saying is, if you just position the sock so that it covers your mouth and nose, and then bring it around to your ears, you can use your fingers to see where the end of your ear touches the sock, and then just fold the edge and just clip off a bit, an inch or so. And you can, of course, experiment, but it's a very simple way to have a way to hook it around your ear.
I've also shared once making it with a scarf. It's very simple ways to do it.
Yes, agreed. this is only a few more seconds, so I do want to let it circle through, but it's just an example, a very simple example. And all I can suggest is that we understand that we have to use what we have right now to be able to make a change in our lives. So I'm just suggesting this is one simple way. And I do want to thank Professor Oliva for doing that. However, as I am one of the panelists, let me first say that I will take this project to our team. I'm the president of 5 Points Youth Foundation. We have a global initiative to localize the Sustainable Development Goals. In Africa, we have several of our Goodwill ambassadors, Shola Agbula in Nigeria, Pastor James Mercy Oban Nibi, and also James Jehoshaphat Moses in Kenya. And I would like for this to be part of what we're doing. I want you to know that civic engagement is a critical way that has to allow our people to understand what their rights are and how to use them. So there is right now ongoing in Kenya a 365-day of civic engagement platform that is stretching across 7 different countries. So with your permission, I'll share what you're doing here, and hopefully we can find a way to connect together our efforts so that this becomes a beginning of a continuing solution that we can bring to this problem. Thank you.
Andrew, may I share one other piece of information before we go?
Please.
And a sense of hope, I hope, especially for Sister Sarah in the situation in Liberia. And for clarity, we talk about the 9 weeks, that's 9 weeks from China, but definitely that was from the World Health Organization, and then also supported by the African CDC. So a real situation that we have not seen the total impact, but I wanted to share as hopefully a sense of hope for us moving forward, that Dr. Jerome Munyangi out of Madagascar has come up with or discovered a tonic out of a 40-year-old lab that was in Madagascar that has been able to right now treat people with COVID-19. It had been my fervent prayer that something for this disease would be from the earth. And how beautiful would it be if it came from Africa? We don't know if this is going to be sustainable, but 37 African countries have signed on to support the research with this lab. You may have been able to see it on Facebook. There's a video, and I'll share with Andrew the link to the video and then the article on the 37 countries who are looking at this research so you guys can have it. You know, we hope that this would be a potential solution that's natural, because personally I'm kind of afraid of the vaccine whole thing with what they're going to come up with. Something has to happen. But I just thought it was awesome when I heard that it was actually coming out of Africa, out of Madagascar. The video is in French. And so if anybody here can translate the video, it's kind of long. It's like an hour and a half long, but just the general messaging. There's a video on Facebook interviewing Dr. Munyangi. And you can also probably search it on Facebook to find his information. But like with the hydrochloroquine, whatever it is that our president is taunting, you know, prayerfully, this will be something that actually turns out to be what really works until we have a vaccine. Until we have a vaccine, we have to act like this is active and around us. And so all of the social things that we can do for ourselves, as far as wearing masks, washing our hands, everything we've talked about today, has to be practiced until there's a solution in place. But I just wanted to say and share, hopefully, I'm so prayerful that this herb that this tonic they've come up with, it's all natural, will be something that actually works out of Madagascar. And I'll post this, and you know, you can look at it for yourself, and we'll just lift it up that it would be a solution. But if anybody can translate the French, because I don't speak French, I would absolutely love to know what is in this video. So I'm going to post it here and share it, and then also share it with Andrew to help get that message out. But I really, really hope that will be a solution, something natural, and like I said, some hope for the future, that we will have a solution. We will have a future. We will get through this. We will get through this. And I wish everyone the best of health and safety as we move ahead until we meet again. Thank you.
Okay, thank you very much. We have Vincent Lin online now. So would like him, he's one of the keynote speakers, would like him to give his presentation. Good morning, Vincent Lin, you're welcome. Please, okay.
Unmute yourself, Vincent. We can't hear you. Thank you.
Okay, great. Okay, fine. Yes. Okay, good. Yep, my name's Vincent Lin. I have a foundation called We Can Save Children. I started it about 6 years ago, and it's empowering not only orphans but refugees throughout from Ghana and Uganda, but I also work in the Middle East as well, in Lebanon and Syria. Last year, actually, I was in Capo Verde, Senegal, Ivory Coast, Ghana, and Tunisia, and Uganda. I usually go there every year and work with about 1,200 different orphans in a number of different orphanages. The situation right now, obviously, in many of these countries, as we know, is quite catastrophic. I'm speaking with local CBOs, community-based organizations in Uganda, and what's happening is we have a situation where many of the orphanages are kind of in a lockdown within a lockdown. So the measures are even more difficult for these child orphans. I have my screen on this end is just says done speaking. I'm not sure if you can see me or not, but I can't really see anything from my end.
No worries, we can hear you.
Okay.
Yeah.
Okay, fair enough. Okay, I'll continue speaking.
Yes, until we work out the.
Yeah, not a problem. Yes. Hello, Rose. Yes. So the situation in Uganda is quite awful, and I know right now we have a situation where there are problems with actual famine beginning. Some of the children that I aid, not only through donations of clothing, scholastic supplies, medical supplies, but as they're going through a lockdown, within a lockdown, there's no supplies of food getting to the orphanages. One of the initiatives I did a few years ago was to buy sustainable agricultural land of around 16 acres, so that the orphanages and the children would not have to, beg, borrow, and steal from elsewhere. So the great thing was they are sustainable in terms of food, but the problem is they can no longer get access to the gardens and to the land. So they're having to rely on the government, who have been handing out sacks of beans and so forth. So there's a lot of problems. I've been obviously having to try to send, the only way is to send money through MoneyGram to at least kind of give them some respite. But the situation is difficult, and there has been a lot of domestic violence, situations of actual suicide, in terms of mothers committing suicide, hanging themselves, and fathers, because they no longer can support and feed their own children. So the situation in Uganda was quite bad. I know they've been under lockdown for some 6 weeks already. President Museveni was actually making a declaration today. I'm not quite sure the outcome of that, telling the citizens whether how much longer the lockdown will proceed. So Uganda is not doing well. Also, I aid an NGO in Ghana, and their situation is quite dire as well. They do it's rescue and recovery of trafficked children on Lake Volta. So they are also kind of a lockdown within a lockdown, and having to protect the children from COVID. So many of the staff are now have been sent home. So it's increased security issues along with the COVID as well for the children. So it's a tough situation. Because of my past experience, I have actually been in the past have taught martial arts to some of the many of the children in the orphanages. It's a self-discipline and self-empowerment, boost their self-confidence and self-esteem, and also for their physical health as well, and mental health. So those are the things that I have been doing these past years. So it's a tough situation, and it's going to require a combined effort. And I agree with some of the other speakers. Definitely, this is going to stay with us for quite some time. And we just have to work together and bring our kind of expertise together and see if we can make the situation better. Thank you.
Thank you very much, Vincent Lee.
You're welcome. You're welcome.
Okay, it was a beautiful presentation. Okay. Would like to know what policy response can be put in place to mitigate the impact of COVID-19 on women and girls in Africa?
For me personally, I've spent a lot of time in those countries that I mentioned, and from my perspective, obviously, I'm working with orphanages, and the age group basically of young children from 5 to high school age, and university level. Obviously, through my experience, having taught them, martial arts, which is a sense of self-empowerment, of course, and self-defense, which is I think much needed, especially where the degree, and it seems a systemic problem throughout the world, not just in Africa, especially here in America, the rising sense of domestic violence that is happening from being locked in for so long. And this is a real terrible and dire issue. In terms of what can one do? It's such a difficult situation because obviously there are small children around most of the time in families. You're in maybe a type of small village cluster setting. Everyone is kind of scared to go out. No one has this sense of, obviously the education of even of basic hand washing, the use of masks, if they can even get the masks. Recently, we started actually making masks. We got out the sewing machine and started using old bed sheets and making actual masks for refugees, which we sent out very recently, a few weeks ago. So we've been making our own and sending and mailing them. That's another thing we've been doing. and so it's a difficult situation because obviously education is very much needed. I did read this morning in Uganda. Even now, what's happening is the local newspapers are now having issues because many of the people have gotten COVID, and so they're being sent home. So any way that they could have gotten any kind of news or education, because obviously many do not have cell phones, so it's from local newspapers. But even that is really been affected as well. So getting any kind of outside news to let them know what is happening, or any type of education or basic education about health or washing the hands has also been obstructed too. So it's a very, very difficult situation. And I don't think any of us really has the optimum answer to your question. Hopefully we can, and I guess every African nation is different in terms of, or every nation in the world, of easing the restrictions and easing the lockdowns. Everyone's kind of taking their own, I guess, doing as they, it's like in America, every state is issuing different mandates. So as every nation is issuing different mandates. So it's a tough situation, and where hopefully the restrictions will be eased slowly and carefully, and educating the public. So let's hope for that. And hopefully we'll be smarter when possibly another wave comes, which I think is going to happen, no doubt. Yeah, thank you.
Okay, thank you very much. Thank you.
You're welcome.
For sharing with us your thoughts. Thank you. Okay, we'll be moving next to questions from the delegates. So if you have questions, you can just raise your hand, and then we unmute you and you ask your question. If you have a question for the speakers so far, those who have spoken to us, if you have a question you would like to ask them, probably something you do not understand or something you'd like them to shed more light on, you can send in, you can just raise your hand, and then we can unmute you. Thank you.
Good morning, everybody, and this is Dr. Muhammad Kota from Egypt.
Okay. Good morning.
Global SDG Goodwill Ambassador, Africa and the Middle East. I'm happy today to participate that COVID-19 pandemic impact on women and girls across Africa. I would like to share something about Africa. To date, most of us have witnessed firsthand how the coronavirus affected our lives and our ability to live, go to work or school or obtain public services. Whatever the case, this affected very far person to person, from man to women. Previously, embodied such as AIDS, like SARS or flu and Ebola, have shown that the most valuable and reliable, whether countries, communities, households, or people feel the most. We would like to draw attention to one of these women and girls affected for the COVID-19 pandemic. First, let us consider the economic effect of the corona pandemic all over the world. Men and women work mostly in the different industries. Women in service sectors have been severely affected by this pandemic. For example, we have to think about female receptionists, and internal supervisors, flight attendants. There are also some manufacturing jobs are characterized by an increase in the female complement. For example, about half of women working in Bangladesh working in textile or garment industry. Another point to keep in mind, especially in low-income countries, is that many women work informal jobs and therefore are not covered by social protection. Shames such as unemployment insurance. A high male rate due the corona would force women left behind to seek social protection or secure other income for their family. Gender gap may increase in the negative effect of corona on women. In fact, there is a great risks represented by increasing gender during the after this pandemic. What we can do for that to make some in reality reaction to develop our countries, especially in Africa, with the risk of the crisis, the economic, with this coronavirus pandemic now. Thank you.
Okay, thank you. All right, Blessing, back to you.
All right, thank you very much, Dr. Mohammed. Would like to entertain questions from the delegates. We have Mberi Jobe. Okay, you can now ask your question.
Thank you very much. I'm glad this meeting. I'm Mberi Jobe a staff of the National Youth Council. National Youth Council was built by an act of parliament to coordinate the young people programs of young people in the Gambia and also advise government on policies affecting them. My question will be, it's a general question anyway, it's like, as we can see, the pandemic is a global crisis. And during this time, SRH services and commodities are very limited. So my question is, how are the government planning, or what are the mitigations they put in place to purchase these commodities? Because during this crisis, we expect unplanned pregnancies and unsafe abortions that may rise during this lockdown. Thank you.
That question has to be answered by somebody.
Well, actually, there's no one online that can answer for any government. So I would suggest.
No, in general, I can make a general statement, because the economic activity has to be started or resumed as early as possible. No government can afford to stay into the lockdown situation for such a long time. Example, I'm speaking from India, and we are in the lockdown situation since last 2 months' time. We are about to complete 60 days in next day or two's time. But the government announcements have come down very recently, just a couple of days ago, that we need to categorize certain areas. Those are in the red category, or the containment areas. I mean, the highly susceptible, highly vulnerable areas. So barring that areas, we need to start the economic activity. So once that economic activity starts, obviously the question which has been raised by Ms. Jobe, that of course will be getting automatically addressed. But nevertheless, this will take some time, number one. And another thing is, people have to adapt to the new normal. Now, new normal, which we have been discussing since now quite some time, that we need to create the self-immunity, the social distancing, keep on washing your hands regularly with soap or normal water, or if you can afford, you can also use the sanitizers, keep on using the masks as far as possible. And when we talk about the masks, there are a variety of masks available, N95, N99, but I would suggest that we can prepare the masks at our places with normal plain cloth, which can be washed at our home with normal soap and again reused it. We can create set of 2, 3, 4 different masks. So once we use it, we come back at the end of the day, we wash it, and next day we can use the other one. So the economic activity has to be started, number one. The other thing is, as I also said in my initial beginning address, this is COVID-19 is another influenza virus. So influenza virus have their own seriousness or gravity looking at its situation. Now this is another serious, this is slightly serious to the earlier ones where we, the communities at large already had been exposed to. But this time it has engulfed more than 185 countries across the globe. So that's why it has become a little more serious, and it has also taken the toll on the death of the people. So the government slowly and slowly, as I said, has to start with the economic activity, and things will slowly and slowly will get back to the normal. We will also get used to these kind of things. The immunity will start developing in our own bodies by creating the antibodies, and therefore we have to start continuing. We cannot stay in the lockdown position for infinite time.
I can also answer Mrs. Job about her questions. I think we should to expand our agriculture all over the world to have a secure food, because you know the crisis of economic now. For example, the oil, it's useless now without nothing, without value, and maybe other things coming, and we'll come back to the nature life. So we should to have a secure of our agriculture food to still have a life, and we try to make something. Thank you.
Blessings.
Okay. Thank you very much.
Let me get back to another question, please.
Yes. Jemo, please can you ask your question?
My name is Stella Jimtai from Kenya. My question is concerning about this coronavirus pandemic. Most women in the rural areas are supposed to go to the farms and look for something that they can feed their families. And at the same time, we have those women who work in groups. So what can be done? These women are at risk of getting the disease, and at the same time, if they're to stay at home, they will not get food to feed maybe their children back at home and the rest. So my question is, what do you think that can be done to help these women maybe earn a living, and at the same time not to be at risk of contracting the disease, coronavirus?
Thank you, Jemo. Now the question is, till the time we get proper medication or the vaccine discovered all over the world, I think we need to maintain that social distancing or physical distancing for some time. And as I said in the earlier question as well, over the period of time, we will also create our own antibodies, and we will also be able to strengthen our immunity to live with it. But at this point of time, when the things are very high, we need to create that social distancing affair very active. So we need to follow that protocol. If we can follow and we can create that kind of awareness amongst our rural women, I think that is the biggest job we can do as an NGO, and that is what I have been emphasizing since quite some time. Let me give you my little background. I am also working with the Rotary International as an NGO. So therefore, we keep on doing these kind of activities day in, day out. The local NGOs, local social organizations, they have to come into the picture. They need to create the awareness among us, these people. Thank you.
All right, thank you for your question, Jemo. Now, Linda, can you ask your question, please?
And
thank you very much.
Anyone not speaking, please mute yourself so that we can hear Linda. Please, Linda, go ahead. Thank you.
Hello. Impact of COVID-19 on women and girls in Africa, and we've come up with a lot of mitigation measures. And like the last responder just said, that NGOs need to come and work together. My question is this: how or what kind of communication strategy can the NGOs or civil society groups come up with to be able to reach out to the vulnerable, the women, the girls in the society who do not have access to social media? The communication strategy that they can come up with to be able to reach out to them with these mitigation measures that we've come up with. They're so beautiful, but how do we get it across to these people?
Linda, what country are you calling from?
Yeah, I'm from Nigeria.
Okay, thank you very much.
You're welcome.
Can I answer that? We have people, we have the chief, we all town crier. These are measures that can be used to reach to the rural or local population. We can send messages through the town criers who will speak in the various different vernaculars or the various dialects to the people, giving them the of learning the protocols to do with this virus, informing the women and vulnerable persons about the virus. We have also the local elders who can also be, utilized in. So yes, areas, different states or counties or local government areas should be able to use this to spread the information on the pandemic and inform the people how to keep themselves safe. So it's, in fact, we in Liberia, for elections, town criers, elders, and the chiefs in government areas. Thank you.
Okay, we have gifts. Gifts, you can ask your question now.
Okay. Hello, everyone, and I want to thank the panelists for the insightful conversation. It's been a great learning opportunity for everyone and me especially. My question is, looking at global statistics, about 70% of women form part of the health force, and 50% more of them are also engaged in unpaid jobs at home and or elsewhere. However, we have only 5% of these women who are around the table and having the opportunity to participate in conversations like this. I want to know, are there processes ongoing or in the pipeline, especially for those of you who have the opportunity to engage with stakeholders and legislature, to intentionally and deliberately develop or create policy tools that can be flexible in the policies that they are making, that can alleviate the concerns of women and girls that has been exacerbated by this pandemic? Thank you.
What country are you calling from, please?
Yeah, I'm talking from Ghana. I'm a country manager for Youth Challenge International, that we work to support and build the capacity of young people, creating entrepreneurial opportunities for women especially.
Could you please type your information to the chat to everyone so we can be able to communicate with you? And I would ask everyone here that has an NGO to use a chat feature to type in your contact information so we can follow up after this meeting.
Great, I'm gonna do that right away.
And if I may address that question, there is Joseph Moses, I mentioned to you earlier, in Kenya, who has begun a campaign to engage the NGOs and the youth. So I would make this available to us all, because the idea is that since this project just began about 2 months ago, it's scheduled to run for 365 days, an entire year, then go again. We would like to involve as many NGOs throughout the continent of Africa, because the ideal way is for us to empower the numbers of people to make a difference, because 80% of the African leaders are 60 years old or over, but 50% of the population is 25 or younger. So we've got to find a way to get some equity for the youth and our communities.
Okay, Manara, you can ask your question.
Hello, everyone. I am Manara Asad. I'm from Sudan. Are you hearing my voice?
Yes.
We can hear you. We can hear you. Go ahead.
Okay. I'm a youth advocate for UNICEF Sudan. I'm here following the COVID-19, what it's going on in Sudan, actually. We reached 2,700 cases. This is yesterday's report. We have facing another challenge in remote areas, in IDBs, especially in Darfur. We're facing challenge of people who lose their taste and smell, and they don't know if there is symptoms of coronavirus or what it's actually. And also we are facing the death of the elders above 60 years old. All of them is like per day maybe from 50 to 60 people per day death in IDBs and in El Fasher city and another cities in around in Darfur area. We actually need we live in a primitive community. They don't believe in the existence of this vital disease. Actually, we believe and they believe in like traditional medicals blindly, and actually they are not aware about what this COVID-19 is meaning. We just like when we said to them that stay at home, social distances, wash your hands, they can't believe that there is something called coronavirus. They even don't know what's going on. So that's the big problem that we are facing right now in Sudan. We need an urgent intervention to help our country.
Manara, are you working as an individual or are you working with an NGO in your area, Manara, in Sudan?
Yeah. Okay, I'm working in 3 organizations. I'm ambassador of NEF organization, is there for African countries, and also I'm a youth advocate for UNICEF Sudan. I'm also international cooperation and donor relations secretariat in NGOs organizations that working on climate change.
Could you type that information into the chat for everyone?
UNICEF Sudan, NEF Sudan, and Sudan Youth Organization on Climate Change.
Manara, I have a small response to your question. the COVID-19, when it started sometimes in November, December in China, then the symptoms, those we were receiving, those were altogether different. The medical studies, those have taken place in USA and other countries now. These studies as recently as in last 10 to 15 days time.
Yeah, exactly.
In those, wait for a moment. In those studies, this is also revealed, as I said it earlier, that these viruses are subject to the mutation. So this virus, which started sometime in November, December in China, over the period of time in last 3-4 months time, this is also mutated. So the symptoms which we used to get earlier, sometimes in January and February, now altogether different. Now, in January, February, we had symptoms only of sneezing, dry coughing, high temperature, sometimes loose motions kind of thing, or sometimes even the spasms in your stomach. Now, over the period of time, which the recent studies have come from USA, they have told that besides these symptoms, there are also symptoms that these patients are going to have. They are not going to have. You raise the question. The people are losing their taste and smell. So this is also one of the indications that the people have the symptoms like the sneezing, dry cough, high fever. They lose their taste. They lose their smell. Kind of thing, or even the upset stomach. Then there are also tendencies of having the infections for this COVID-19. So we need to be careful. We need to be very watchful about the people who are suffering from these kind of indications, receive these kind of symptoms. So whenever there is such kind of symptom, we immediately need to get down to the nearest possible hospital or the clinic where we can get that individual examined, tested for the COVID-19, and then accordingly the next protocol can be started. That we need to be very, very careful. Thank you.
Okay, so thank you.
Thank you.
Okay. Thank you very much. And on this note, I would like to say a very big thank you to all our guest speakers and all the delegates from countries like Sudan and Ghana, Somali, Gambia, Lesotho, and all other countries present here today. I'd like to say a very big thank you for your participation, and most importantly, our moderator, Mr. Andrews Williams Jr. Thank you. You did a wonderful job today. Thank you so much, and I'm really grateful.
Well, let me also thank Mr. Mohammed Fahir, who brought me to this network. He's been part of my
Thank you. Also, thank you, Mr. Andrew. He invited me for this here, but I have some recommendation if I have a time to talk about that.
Okay, you should.
I have some idea about how we can try to find a way how to solve our problem with coronavirus, COVID-19. E-commerce platform for work of social development and development of the startup and the small companies is a field of particular visual application that can be very large business sector particated through the home, trade or online sales. Number 2, the digital transformer of the government and banks. Applications for enterprises, some productive applications which can help monitoring the work progress and development and enhance 2% of their commercial activities on the internet more effectively. Applying remote quarantine work without restoring the hospitals. Understand? Special education applications for children to teach them culture of health protection application of waste and damage management, masks, gloves, and others, applications of large solution and the medical devices, thermal, sports application for dispense with gyms, prepare for conduct training courses and workshop program from agricultural development and food security. This is what I'm thinking we can do from the home now. Thank you very much.
Yes. Very good one. Thank you. Okay, we have Dr. Evelyn Beatrice. Please, can you say something? Hello, doctor.
Hello, everyone. Thank you so much for this opportunity. I'm sorry my network went off. I'm supposed to be moderating, but I thank Mr. Williams Jr. for the great work done. We thank you all the participants, delegates, and our experienced panelists. I'm so grateful. I was coming in and out, and then I had a great moment and great experience. Thank you so much.
Thank you, Dr. Evelyn. And yes, stay safe, wash your hands, sanitize, and most importantly, stay indoors. And we've had a very beautiful deliberation today, very wonderful. And Mr. Williams, please, would you want to say something before we go?
Yes.
Pardon?
I would like to again thank everyone for attending. We're all connected through social media. You can always reach me on Facebook at Andrew Williams Jr. or Ambassador Andrew Williams Jr. And I do stand ready to assist all of you. So reach out to me. Let's get this thing done.
Okay,
yes,
thank you.
Andrew. Yes, Andrew. Excuse me, please. Yes, Andrew, and hopefully we can expand our courses network and our meeting more and more every week. If we can schedule that to discuss and try to find a way how we can improve our life with the pandemic coronavirus, which we have now.
Well, yes, I wanted to let you know that we are already having weekly online, for the next 2 years, we're having weekly online sessions. I would ask you to allow us to include this project in our weekly plans so that you can continue the work you've done here.
Okay, of course.
Thank you.
Very
Thank
good.
you. Thank
Great.
you, everybody. Thank you very much.
Okay.
Thank you.
Okay, thank you.